Hello, good afternoon or good morning, depending on where you are located, and welcome to our webinar on taking action to keep formula marketing out of healthcare facilities. This webinar is co-hosted this morning by the U.S. Breastfeeding Committee, Public Citizen, and Ban the Bags, and we are very happy to have you with us. Just going to do a little bit of quick housekeeping to get started. I am Megan Renner from the United States Breastfeeding Committee, and I will be moderating the webinar today, dealing with the logistics and the question and answer session. I'm going to go ahead and introduce our presenters for today. First, we have Liz Benishai. Liz is a senior researcher in the President's Office at Public Citizen and also the campaign coordinator for Public Citizen's campaign to stop infant formula marketing in healthcare facilities. Public Citizen is a consumer protection organization based out of Washington, D.C., and they have more than 300,000 members and supporters. Our second presenter today will be Marcia Walker, and Marcia, many of you know, wears many hats. Today she is presenting in her capacity as the chair of Ban the Bags, a national campaign that grew out of the work of the Massachusetts Breastfeeding Coalition. But some of the other hats that Marcia wears, she is also the executive director of the National Alliance for Breastfeeding Advocacy, Research, Education, and Legal, and the current chair of the USBC Advocacy Committee, among many other roles that Marcia has. So without further ado, then I'm going to flip over to Liz's slides, and you can take it away, Liz.
Great, thank you so much, Megan, and really excited to have everyone here today. What I'm going to do is give you a brief update on our campaign. I'll tell you a little bit about the plans we have for the coming months, and then we'll get right to explaining how you can take action and help us to achieve the campaign goals. Next slide. So I know we have a mix of USBC-affiliated folks and public citizen supporters participating today. Many of you are already familiar with this campaign, but for those who are newer to the campaign, I wanted to just briefly go over the goals of the campaign. In April, Public Citizen launched a campaign to stop infant formula marketing in healthcare facilities. We started out by focusing primarily on the so-called discharge bags that infant formula companies, which are big pharmaceutical and food companies, distribute to new moms in maternity wards after they give birth. We oppose this practice for several reasons. First, there's clear evidence showing that moms who receive these bags, which contain formula samples and other marketing materials for infant formula, are likely to breastfeed for shorter durations and are less likely to breastfeed exclusively. However, all major health organizations recommend at least 6 months of exclusive breastfeeding. So we know there are significant health risks to not breastfeeding and, in turn, serious risks to the public health of distributing these sample and marketing bags. Second, by giving out these bags, healthcare facilities are essentially being co-opted by the formula industry to serve as marketers. And they're essentially endorsing formula feeding despite the fact that, again, there's strong evidence supporting the risks of formula over breastfeeding. We don't think hospitals should be venues for commercial advertising of any kind, but particularly in the case of products that are inconsistent with medical recommendations and best practices. So the campaign is really all about ensuring that big business profits, and the infant formula industry is certainly a big business, that they don't trump the needs of families, harming the health of families and undermining their access to quality health care. Next slide. So what have we done so far? We sent letters to 2,600 hospitals across the country, and these letters were co-signed by over 100 organizations, including USBC, many breastfeeding coalitions, and national, state level, regional, and local health and consumer groups. So a really wide range of groups signed on to this letter supporting this initiative. At the same time, we launched a petition that targets the big three formula makers, so that's Abbott, Nestle, and Mead Johnson. And since we launched that petition, we have more than 15,000 people who've signed it, and the petition is calling on the formula companies to stop using healthcare facilities to market their products. We generated quite a bit of press, as some of you know. Of course, there was both supportive press and critical press, but we consider all of it to be good press as it raises the profile of this issue across the country. Not only did we get the attention of the media, we also got the attention of the infant formula industry. The industry was vocal in the media opposing the campaign. And they also went ahead and sent letters to those hospitals that we had initially sent letters to, providing misinformation and trying to counter our recommendations, which were based solidly in scientific evidence. At the same time, we launched a sort of mini campaign related to this one, calling on the governor of Michigan and the mayor of Newark to end partnerships that they have recently entered into with Nestle, of course a major producer of infant formula and junk food, to work on anti-obesity and infant nutrition programs of all things. So through our action alert, about 5,000 people sent emails to both the governor and the mayor, and we continue to monitor this issue and have plans to continue to address what we see as a really problematic relationship, of course, between Nestle and these governments. So what's happening next? Next slide, please. We're really excited about our next initiative, which is a healthcare providers pledge. So we know that a significant amount of infant formula marketing takes place outside of the hospitals and inside of doctors' offices. And particularly as some hospitals choose to stop giving out the discharge bags, which is great, infant formula companies will be looking to get into even more OBGYN or pediatricians' offices to market their products there. So we're launching a pledge which healthcare providers will be able to sign on to, declaring their intention to keep their office free of infant formula samples and marketing materials. And we're about to launch this here in DC, where Public Citizen is located, and then we will soon push it out nationally. So we're excited to get lots of healthcare providers on board and to take kind of proactive steps to make sure that this potential result of getting the formula companies out of the hospitals doesn't lead to more infant formula marketing in doctors' offices, and also to counter the already pervasive formula marketing in healthcare providers' offices. We're also planning to focus in on some specific areas around the country where we can do some more on-the-ground organizing to mobilize advocates to pressure their area hospitals to stop allowing the marketing. And we're still trying to determine which areas we'll do this in. We've been in talks with a number of people across the country to figure out where we can be most effective. At the same time, we're considering some outreach to medical professional organizations, which you may know, many of which take significant financial contributions from, among other questionable sources, the infant formula makers. So we're looking at ways to address that. And finally, we want to follow up with the hospitals, and that's where you all come in. And I think we have a good number of people on the call, and we can really make a lot of headway on this today. So what I'm going to do is tell you how you can help us to follow up with the hospitals and outline some easy steps you can take. Next slide, please. So our goal is to contact as many of the 2,600 hospitals on our list as possible. And that's a lot of hospitals, of course, but we think we can make some significant headway. The point is to pressure the hospitals to acknowledge and to respond to the letters. So somewhat unsurprisingly, most hospitals have not responded to the letters that we sent. We've heard from a few, but for the most part, we haven't heard. So we think voices from the community, voices from supporters of this campaign will help to push the hospitals to at least respond in some way to the letters. We also want to make sure that the letters get a second or perhaps a first look, and you can help us to make that happen. And finally, to, again, demonstrate support in the community so that the hospitals are well aware that this isn't just a few people out in DC who want to initiate this change, but that there's widespread support for it. Next slide, please. So the first step to making your calls is to find the hospitals in your area that have received letters. What you'll do is you'll go to our website, and I should say all of this information will be on the website that you'll receive a link to after the webinar. So don't worry about trying to scramble to write it all down right now. So on our website, you'll click on See Which Hospitals Received the Letter, and next slide. And once you do that, you'll get to a PDF file. It's a pretty big file, so you might have to give it a few minutes to download. And that'll give you the list of all the hospitals that received our letter. Once you're in there, you can use whatever your search function is on your browser, Control F or whatever it might be, depending on the browser you use, to find your location. So here in the screenshot, I'm here in Washington, D.C. I searched for Washington. I saw there are 6 hospitals that come up. And at this point, you can determine which hospitals you are going to call. A couple things. First of all, as many hospitals or as few hospitals as you can reach out to is just great. So if you only have time to call 1, that's perfect. If you've got time to call 20, that's amazing. So please, even if you have just a little bit of time to give, you can definitely help us out. You might also find that there is not a hospital on here in your area. So in that case, you should take a look at the list and see if there are hospitals in the sort of general vicinity, maybe in the region or even in the state. And even though there's not a hospital in your particular area, we think you can still be effective calling other hospitals. Another thing, you might wonder, well, what if someone else chooses the same hospital as me to call? And we think this isn't a problem at all. In fact, we want the hospitals to hear from as many people as possible. So even if someone else has made a call yesterday and you're calling today, don't worry about it. We think it's still going to be effective, and in fact, even more effective. Next slide. So before you make your call, you probably want to prepare some of the materials you'll need. You can get a copy of the letter from our website, and again, this link will be available to you in the follow-up materials for the webinar. And you might want to just read it through so you're familiar with what it says, even if you took a look at it back in April. You can also download some of our talking points, which are on the website, and those will just kind of help you to familiarize yourself with the issue and remind yourself of some of the ways that we suggest responding to the questions you might encounter. Get your pen and paper ready to go to write down any follow-up info. And then you'll find all this, as I said, on our website. Next slide, please. So step number 3 is a little bit tricky sometimes. Hospitals are often large and bureaucratic, and their websites reflect that. So what we'll be asking you to do is to find the contact information for the hospital online. So you'll go to Google and search for whatever the name of the hospital it is that you're planning to call. And then once you get to that hospital website, you'll need to search around to find the correct number. And sometimes it's really difficult to figure this out, but don't worry if you are having trouble, if you kind of search around and you don't see any of these possible contacts, which are listed on the slide. So the administration office, executive office, CEO or president's office. If you can't find any of these, then you might want to just call the main information number and say, probably the best thing to say is to say, can I please speak to the CEO's office or the administration office? And they should be able to connect you. I have chief of obstetrics here. I would first try the administrative offices, though, since that is who we address the letter to. Next slide. So you've got the number for the person you're trying to reach, and you've been connected. What will you say when you get through? Here's just a sort of example of what you might say. Of course, you should adapt it to whatever you feel comfortable with, and put it in your own words. But sometimes if you're feeling a little stressed calling, it's good to have just a bit of a script in front of you that you can diverge from if you want to. So you might say, I'm calling to follow up about a letter that was sent on behalf of over 100 organizations to President whatever, and asking your hospital to stop allowing distribution of industry-provided infant formula samples to new moms. I'm a member of the community who supports this initiative. Can you tell me what the hospital's response to this request is, or direct me to someone who can respond? So, if you're not a member of the community, obviously you don't need to say that part, but the main gist of it is you're asking them for a response to this letter, which you'll want to identify as a letter that was calling on the hospital to stop providing infant formula samples to new moms. Next slide, please. So just a few tips from the calls, for your calls, and I made similar calls like this here in DC, so the tips reflect my experience. So number one, you might need to be a little patient. So you might get transferred around to several different people before you get the right person. You might even get disconnected and have to call back, but try to stick with it and take it as it comes. And be polite, of course. Seems obvious, but you may not be dealing with someone who is equally polite on the phone. Someone who's busy or had a long day, but we're not really in attack mode here. We're trying to encourage the hospital to respond to the letter, so we want to be as polite as possible, and also be firm and don't give up. And this kind of leads into the next point, which is try to get people's names, their numbers, and dates for when you should expect to hear back from them. You might find people who will try to kind of brush you off pretty quickly and tell you that they'll get back to you without really seeming as though they will. So try to get some kind of commitment and some way to follow up with them. And I'll just go into that a little bit more in the next slide, please. So here I'm going to go through a few possible responses that you might encounter. First one, the person on the phone might say, the president receives hundreds of letters every week. I'm not sure what his or her response is to this one. Or they might say, we didn't receive the letter. Okay, no problem. You can respond to that on the next slide. So you can say, I understand that President X receives a lot of correspondence or may not have received the letter. I actually have a copy of the letter on hand. Is there someone I can email it to so I can make sure that he or she reads this important letter, which was written on behalf of hundreds of organizations with hundreds of thousands of members across the country? So this isn't just a letter from me, the caller. It's from a lot of people. It's a serious letter, and you're ready to email it to them. So whether or not it's true that they didn't receive the letter, it could have gotten lost, gone to the wrong department. We want to give them another opportunity to take a look at it. Next slide. So the next response you might hear is just, as I mentioned before, I'll look into it and get back to you, and they might want to take your name and phone number. So what you'll do is you'll give them your name and your phone number, and then a useful thing to do would be to say, would it be helpful if I emailed you a copy of the letter too? Can you give me an email address to send it to? And then again ask, when should I expect to hear back from you? So having that email connection, giving them an electronic copy of the letter can kind of speed along the process. If they look into it, as they say they're going to, and find that they can't find this letter, at least they'll have an electronic copy. And you also have a means of connecting with them to follow up. Next slide. Okay, here's one that you may get. We've already stopped giving out formula samples and marketing materials. Okay, well, great. You say, congratulations, that's great news. And you can suggest that they add themselves to the list of hospitals that are bag-free, which Marcia, who's going to speak after me, maintains over at banthebags.org. So we know that the list of hospitals we sent letters to had some inaccuracies because it was such a large number of hospitals. It's very difficult to determine which hospitals were and weren't giving out the samples. So this is a possibility that you'll encounter. But it's great to find this out. First of all, that's our goal, so it's good to hear. And second of all, it'll help us to update our lists and have an accurate list of the hospitals that are and aren't engaged in the practice we're trying to stop. Next slide, please. Okay, so you've made your calls. Maybe you made 3 or 4 calls and you went through these steps a few times. What you want to do afterwards is make sure that you send whatever follow-up emails you said you were going to send. And if you said you'd send a letter, you can go to our website and click on Read the Letter, calling on hospital executives to end formula marketing in their facilities. You'll be able to download the letter in a PDF from that link, and you can save it on your computer and attach the letter to your follow-up email. When you send the email, it would be great if you CC'd us, and this information again is in the follow-up materials you'll receive. But you can CC us at formula.marketing@citizen.org. That way we can also sort of keep track of what's going on. Next slide, please. And then once you've completed all your follow-up emails, send us an email or a call to let us know how things went. We really want to know what happened, even if you feel like you didn't get anywhere, you didn't reach a person to speak to at this hospital, or you feel like you got kind of brushed off. Still would be great to hear from you so we can keep track of what you've done, and it'll be useful for us moving forward. And as you're working on this, feel free to contact us at any time with questions. My phone number is in the materials, the follow-up materials you'll receive, and I'm happy to chat with you about different strategies to take this action or others in your community. And then the full instructions are at that link, which you'll, of course, receive. So that's basically it. Again, it's a pretty straightforward process, just a few steps, and you can really help us to move forward with this campaign to put pressure on these hospitals and let them know that we expect them to take action on this issue. So thank you so much for your hard work. I know many of you are hard at work on this and other important issues already, and we look forward to your participation in this initiative. So Marcia, I think, will give you some other ideas about how you can take action in your community, and also some further background on the movement so far, which she's been instrumental in pushing forward.
Thank you, Liz. What I thought I would do real quickly is to review how this all got started. We get many questions on, well, where did this come from? Did it come from out of the blue? Next slide, please. Discharge bags have been used probably for over 40 years in U.S. hospitals. The potency of this particular type of marketing is such that I have found examples of it in marketing textbooks, so that we know that it is very, very effective. It certainly implies that the hospital is endorsing formula in general, and that it's endorsing a particular brand, which obviously is the one they use and give out to moms. Next slide, please. HIPAA defines that as a form of marketing, and I have found that using just the name HIPAA usually causes people to perk up their eyes and listen to what you're saying. The only problem with HIPAA is that the mother does not have to sign a form saying that she understands it's a form of marketing. In other words, HIPAA says that there's no prior authorization needed when a hospital provides this to the patient. So she thinks, on the one hand, that she's getting this lovely gift from the hospital that was specially chosen for her baby, when in effect she is not being given all the information in terms of, no, this isn't a charitable gift. This is marketing 101. Next slide, please. We also found that if mothers really, really want one of these things, they can call a toll-free number, and the formula company will send it to them. What you're seeing up on the screen now is Mead Johnson's offer for a discharge bag. And what the mothers can do is to print out coupons or print out this form from the company's website, take it to the hospital, and ask the nurse for it. And they just want to make sure that mothers remember to do that. Now, we have found some of the hospitals were worried about what the mothers would say if those bags were not available. And what we found is most mothers do not immediately leave the hospital. They don't choose another hospital. They have very little input in terms of complaints, although you may get some now and then. Most hospitals simply say, they take the coupon and they say, oh, we don't participate in this program. And that's that. We don't need to worry too much about that. Next slide. The other thing we found is that these bags are not free. There is a very high cost to these bags. And again, mothers and many healthcare providers do not realize that those bags will cost a mother, a formula feeding mother, at least another $700 per for the year that they're going to feed their baby that brand name formula. And that's because the most expensive brands are the ones that are put into those bags. If the mother used store brand formula like Walmart or something like that, they would save themselves at least $700 a year. And so there is nothing here that is free. Those bags are paid for with the high cost of infant formula, so that the mothers that buy the formula pay for these, quote, free bags. Next slide, please. I just put this up here to make sure that we use the correct marketing lingo, and it's sampling. The sampling is extremely important to get a sample of the product in the hands of the consumer. And so what this does, especially with breastfeeding mothers, is it creates a market where none existed before. Now the timeline that's okay, you can go to the timeline now. This I've just put in so that you can have a little bit of an idea of the history behind all of this, and perhaps the way that you might work in your state in terms of getting rid of these bags. This started in Massachusetts in 2005, where our Department of Public Health had opened up the hospital regulations for revision and for comments. And so what we did is we wanted the hospital regulations to state that these bags could not be given out by hospitals. Now, these types of regulations are mandates upon the hospital. So we decided not to go the route of legislation because there's too much lobbying influence with that. And we wanted to go through the route of perinatal regulation. And there was public testimony on this. We had to get up in front of the Department of Public Health and the state and talk about why we wanted these bags removed. There were 8 comments that favored retaining the bags, and you can see the usual round of suspects who these would be coming from. Next slide, please. These regulations that we provided were then approved by the Massachusetts Public Health Council. In February of 2006, we couldn't figure out why this had not gone into effect. Why wasn't it signed and in our hospital regs? Well, it turns out that the governor's office invoked a little-used rule that said it has to approve all new regulations. And Governor Mitt Romney at that point in time rescinded the formula ban bag, saying that he thought it interfered with mother's choice. Now, at the Public Health Council meeting, 3 members objected to the governor's rescinding of the bag prohibition and asked for a 3-month study period to look at how we could get this back in. Next slide. Of course, Mass Breastfeeding Coalition flew into action. There we are standing in front of our State House talking about why these bags needed to be removed. We had press releases. We had stories in the newspaper. We wrote to the legislators. We met with the Office of Administration and Finance. We even sent a petition to the governor with 3,500 signatures asking for a reinstatement of that ban. Next slide. This is one of the graphics that we produced. This was put into a parenting magazine so that everybody understood that those bags came with a price tag, that they were not free. Next slide, please. Meanwhile, unknown to us, Governor Romney removed 1 member of the Public Health Council who supported the bag prohibition. In May, 4 days prior to the meeting of the Public Health Commission, he removed the other 2 ban the bag supporters. So essentially what happened, he manipulated the Public Health Council to the point where the regulation did not pass, and it reverted back to the old language that was in the perinatal regulation. And unknown again to us, he was actively courting Bristol Myers Squibb, which at that time was the parent company of Mead Johnson, who was building a big $600 million facility here in Massachusetts. So we really hit the hardball politics on that one. Next slide, please. The perinatal language that we have here in Massachusetts in our hospital regulations now states that discharge bags cannot be given to mothers unless the doctor prescribes it or the mother requests it. And of course, that is easy to get around. That was the whole idea of putting this into the perinatal regulations to begin with, which was to strengthen that language. Next slide. Then we got hit again, broadside, with a bill that was filed that would support the giving out of the bags. and this legislator filed it. It was at the behest of one of the formula companies, or probably the Infant Formula Council. They started a new website, which you can go to, see momsfeedingfreedom.com. And again, they were trying to come around the backside by getting a law passed in Massachusetts saying that the bags had to be given out. That bill, fortunately, did not go anywhere. We lobbied very heavily against it. Next slide, please. Well, after we did all of this work here in Massachusetts, we decided, why not go national with this? Why not have everybody start working on getting these bags out of the hospital? It's a small step, it's low-hanging fruit, but it certainly is helpful in terms of reducing the amount of marketing that mothers are exposed to. Next slide, please. So we started Ban the Bags. We have a website called banthebags.org. On that website is a toolkit of a lot of resources, and there's a wealth of information there for questions that you may have, approaches that you might want to use. And I also get many emails a week saying, how can we respond to this, that, or the other thing that the hospital has put up to challenge getting rid of the bags. And I am most happy to do that. You've got my email address, so please don't hesitate to email if you have questions, problems, or need a little bit of advice. Next slide, please. The other thing that happened in Massachusetts that was very, very effective is we had a group of people form what they call the Mother-Baby Summit. And this is at the leadership of Dr. Bobby Phillip over at Boston Medical Center. They put together 4 Mother-Baby Summits, and these summits were for hospital administrators. And this got the administration in on getting rid of the bags and going baby-friendly and this type of thing. We also sent a letter to our hospitals in our state telling them about the potential hazards in the discharge bags, which many of them were unaware of. And you can go to our website, or the Mother-Baby Summit website, and see the letter that we sent to all of our state hospitals. Then what we did is just publicly shame the hospitals. We had a little hall of shame. And at our Massachusetts Breastfeeding Coalition conference, there would be a list up by the podium on a great big poster board about all of the hospitals that were still giving out these bags. And so it was a public embarrassment, especially to the people that were there from those hospitals. Many of them went back, told their administrators how awful it was to see their hospital in this hall of shame. Next slide, please. So where are we now? I counted up 603 hospitals on Ban the Bags website that have eliminated the distribution of these commercial discharge bags. I know there's more. They just haven't reported into us on our list, but that's pretty good. 17 hospitals in the city of Portland, Oregon got rid of the bags. And then what happened is the state of Rhode Island became the first state to go entirely bag-free in all of its birthing hospitals. Now, they only have 7 there. It's a small state, but it was still a good first step. There have also been a number of studies published on discharge bag effects, and so that has been very helpful, too. Next slide, please. The city of New York is on a big breastfeeding campaign, and they, too, are working very, very hard to get rid of these bags out of New York hospitals. The 23 of the 40 hospitals in New York City that deliver babies have signed up for this campaign so far. So this was at the leadership with the mayor of New York. Next slide, please. And I have to proudly announce that as of July 1st, all 49 Massachusetts birthing hospitals will be bag-free. We are really excited about this. We finally got the last holdouts to give up the bags, and I think it was a lot of peer pressure, our hall of shame, and just finally understanding that this really was not the mission of a hospital to give out potentially harmful products to their patients. So starting July 1st, we will now have 2 states that are bag-free. Next slide, please. Now, there's a lot of objections that you're going to hear about about eliminating these bags, and we've heard them all. Believe me, we were told that the mothers want the bags, that the poor mothers need the bags. Now, this was a gem. What are the poor mothers going to do if they don't get this bag with the formula in it? And of course, we just came back and said, well, The amount of formula in these bags lasts about 1 week. How do you think they're going to feed the babies for the rest of the year? So you want to be careful and make sure that you have got rebuttals to every one of these types of objections. We had people yelling at us that we were forcing people to breastfeed. And we, again, had to patiently explain the purpose of the bags and why we needed to have them out of the hospital. We had to talk about making bottle-feeding mothers feel guilty. That was thrown in our faces constantly. And we finally, again, had to have a response about the guilt issue, which is nobody can make anyone else feel guilty. In the mental health literature, guilt is a feeling that one chooses to feel. If people want to feel guilty, that's fine. Mothers do not need to be protected from the outcomes of their decisions. They're very strong. They don't need to be patronized. They need to understand what these bags are, what they do, what they don't do. Then people were concerned that the hospitals would have to buy their formula. Oh, if we give the bags out, they're going to take away all of our free formula, and they're going to take everything away from us. Well, actually, that's not what happened. The formula companies, from a business perspective, would be very foolish to remove all of their materials and formula out of a hospital, because that's one of the major ways that they market their product. And our experience at Ban the Bags has been that nothing like this happens. It's saber rattling. There would be no pulling out of anything, because then the mothers would not be exposed to that particular brand of formula. Next slide, please. We always need to understand that gifts have strings attached, and we need to understand exactly what those bags mean. And what I put here is just a list of these types of things that you can use to talk about. We have found that this can be very effective. Some hospitals could care less about breastfeeding, but they do not want to be taken advantage of or be used by a company to market their products. And so it became, for many hospitals, an issue of ethics. Next slide, please. And as Liz mentioned, when the bags go out of the hospitals, they find other places to put the bags. And so you'll see some of these discharge bags or bags like that in pediatric offices, OB offices. We've even had reports of the bags being given out in ultrasound departments. When a mom goes in prenatally for an ultrasound, she's given one of these bags. And so what we would want to do, along with getting the bags out of the hospital, is have you contact any of the pediatricians and obstetricians that are affiliated with your hospital out in the community and ask them to refrain from giving these out. The picture that you see on the right-hand side of that slide is a breastfeeding resources kit. It says for the breastfeeding mother on her first visit to the pediatrician. And of course, what's in there is infant formula. Next slide, please. You can make your own bag. It's very easy to do this. Marketing departments have money for this. Next slide, please. If you don't want to make your own bag in the hospital, you can buy these types of bags. Cottonwood Kids, in particular, has discharge bags that can be given out to all mothers without the formula company logos or products. Next slide. So here's more take action. And you've heard from Liz about writing letters. If you work in the hospital, use the system in the hospital. Talk to risk management. Tell them that the formula that is in these discharge bags is not sterile and it is subject to recall. They have no stock control over these bags and do not know to whom they have given the bags. In case there's a recall, how would they ever let these mothers know not to use the formula that was given to them? And so generally, risk management doesn't like to hear something like this. And we've had hospitals who have stopped giving out the bags based just on that. You also have ethics committees in the hospital as well as corporate compliance. And you would want to go to each of these, again, objecting to giving out these bags. We talk about informing about the hazards of what's in these bags. We urge you to do the same type of breastfeeding summits that we did here in Massachusetts, where the administration of the hospitals are invited to these offerings. We use the Hall of Shame, and peer pressure worked pretty well, I have to say. I think that's how we got the last few holdouts. Just say no. Do not give them out in the hospital. And the state, I just mentioned our state hospital perinatal regulations. You too can look at the hospital regulations in your state to see if you can get it put in there. The next slide. And so now we are laying down the challenge to all of you. We want you to be the next state to go bag-free. Wherever you are, now is the time to eliminate formula company discharge bags. And we hope that this webinar has helped you a little bit in giving some background and some information on this, and so that you know where to go to get help when you need it. Thank you, and thank you for having me on the webinar.
Wonderful. Thank you, ladies. This is Megan again, and we're going to go into our question and answer period now. Just a quick reminder, if you joined us late, you can ask questions by typing them into the questions box that appears on your webinar control panel. So if that questions box is not open, you'll just need to click on the arrow next to the word questions, and it will open up the space for you to type. So we do have a number of questions that have been submitted already. One of the first ones, we have a couple of different questions about how you determined which hospitals to contact. Would you like to elaborate on that a little bit, Liz?
Sure. We drew on Ban the Bags, Marcia's, the group that Marcia chairs. Their website had a list of hospitals that had banned the bags. And then we got a list of all of the birthing hospitals in the country, and we removed from that list the ones that were on Marcia's Ban the Bags list. So that was how we came up with the list. But as Marcia said, there are some hospitals out there that have stopped giving out the formula samples, but aren't on the list of those that have banned the bags. So we anticipated that we might hit some situations where the hospitals we sent the letter to had already done away with the formula bags, but we figured it's better to hit as many as possible and try to get the attention of those that were still engaged in the practice.
Mm-hmm. I just wanted to comment that there are a handful of comments from folks that are saying this hospital has banned the bags and they're not but they are still on the list. So I just want to let folks know, if you did submit a comment like that, we will share all of the comments and questions with the speakers so that all possible lists can be updated after the call. So thanks for sending those. If there are others that you are noticing are still on the list, as Liz just said, sometimes they may have banned the bags but were not listed on the Ban the Bag site for whatever reason, and we will continue to update those as we find them. Let me see. We have a related question about how about offering to add the hospitals to the Ban the Bags list for them? Is that something that you would recommend, or why or why not?
I'm not quite sure I understand the question. We asked that a hospital who has stopped giving out the bags, and that means to everyone. We've had people try to report to Ban the Bags that they got rid of them, and in effect, when our office called them, they had gotten rid of the bags only to breastfeeding mothers. They continued giving them out to everybody else. And in order to be on the list, you have to stop giving them out totally to everybody. Mm-hmm. So if you want to add your name to the list, we ask that you do it on the website, because that puts it into our system, and then it allows our people to make a call to the hospital to actually verify that they got rid of the bags throughout the entire hospital, not just the breastfeeding mothers. So you need to, if you want to add your hospital to the list, you need to go to the website and do it that way. If you have found that a hospital has reverted back to the dark side and started giving out these bags again, we also want that reported so that we can remove them from the list. And you can do that the same way by going into the website and just sending us a note. If none of that works, certainly email me and I will pass that on.
Okay, yeah, thanks, Marcia. That's what I wanted you to get at, was the fact that you do verify it so that it's not as simple as the person that's talking with somebody can add the name, that your group does verify.
Oh yeah, you have to, Megan. Otherwise, you get all kinds of people who think that they stopped giving out the bags when in effect they're given out right and left.
Exactly. Okay. So yeah. So you answered exactly what I was hoping. Here's another question. We have a few different questions about the materials, the handouts and slides, and just to repeat, the link that Liz provided in her slides, all of the materials, the slides will be posted there, as well as the step-by-step instructions are already there for how to take action. I also want to just note for folks that if you missed that link in processing through the slides, you're going to get it from the webinar system in your follow-up email. So watch for that follow-up email that will come out saying thank you for attending the webinar. You're going to get all the links both to Public Citizens materials and Ban the Bags. This looks like it's a question from Marcia about the Ban the Bag objections that you listed on your slide. Is there a script for each one of those that might be shared?
We have a little bit of that on our website. If you do not see, if you run into something or you think you're going to run into something and you need a script that you don't find on the website, email me and I will provide you with one. I'll go over it with you and give you some talking points on that.
And we also have some Q&As and resources like that on the Public Citizen website, the citizen.org/infant-formula. You'll find a whole bunch of resources as well.
We have several congratulations on Massachusetts going bag-free, as well as Rhode Island. Are either of those two states that have completely banned the bags, do either of them have formula companies based out of them?
No.
Another similar question, have children's hospitals been considered for the list, or is it just birthing hospitals?
I think we have some children's hospitals on our list.
Yeah, I think in terms of the...
Oh, I'm sorry. In terms of what Liz sent letters to, or what's on Ban the Bags?
I guess either. The questioner didn't specify.
Well, in terms of the letters, we sent them to birthing hospitals, but we're certainly open to, in the future, looking into targeting children's hospitals that are also giving out formula samples.
And I can't remember if we have any listed at Ban the Bags or not. I thought we did, but I'm not sure. Certainly, children's hospitals can report in on our website. Again, as long as they have stopped giving out the bags totally and completely. That means to everybody.
We have a question about the media blitz, or the media outreach that was occurring state by state. The questioner says there was a lot of interest by our hospital administrator after the letter arrived, but the media outreach didn't seem to reach our state. Questions and pressure from the press can make more of an impression. Any thoughts on how people can get involved or start up the media outreach?
Yeah, we can certainly help. What happened with the state outreach, we went ahead and did press releases for the states where we heard from groups and where they provided us with a quote from their group to use in our press release. But some states I never got that information, so we haven't been able to move forward on that. But we do have press lists for every state that are ready to go. So if you are in a state where we haven't yet done a push to the media, feel free to call me or email me, and we can definitely do that in the weeks to come.
Yeah, just a quick thing. It is very important, if you want media attention, to make connections with the media in your own state. Pitch the story to this media. What we do at Mass Breastfeeding Coalition is we have a little list of the media that we use when we want to get something out, and we have tried to develop a close connection with some of the reporters at our major newspaper, the Boston Globe, as well as the local TV station. And so again, it is something that you might consider doing in terms of starting to make a connection and contact these people periodically to let them know who you are, what's going on, hey, I've got a potential story for you, that type of thing. It's basically repetition and just getting yourself known to them for these types of questions and stories.
Yeah, and we're Public Citizen has a really great communications office that has a lot of experience in working with the press. So we're happy to help. Again, just get in touch with me.
Are state health departments receptive to banning the bags across the country? I don't know if that's a generalization you can make, but any experience with state health departments?
Well, here in Massachusetts and in Rhode Island, the state health departments were very, very supportive and worked along with us to get rid of these bags. It is something that you have to contact your own state Department of Health to see how likely they are to want to pitch in, to want to affect this type of change. Some of them are very willing to do so. Some have no clue that this is even a problem. And so it would be very beneficial for you, all of you, to contact your state Department of Health. Ask them about this. Tell them this is a problem. Tell them why with the information. Ask if there is anything in your state hospital regulations about this type of behavior, and ask if you can add language to your regulations that state that this is a practice that is not to be engaged in.
Yeah, and I know we've seen most recently the Department of Health in New York State is really committed to this issue and doing a lot of work. So I think that's definitely a potentially fruitful way of addressing this issue, and we'll certainly be pursuing that as we move forward. And if you have a sense that your state would be a good place to look into that kind of advocacy approach, then again, I welcome your suggestions and calls and emails.
We have a number of questions about, we know you mentioned the ultrasound offices, and there are a number of questions about the pediatricians' offices. Do you want to talk just a bit about initiatives in that area?
Liz, were you going to talk about that?
Well, as I mentioned, we are soon going to be launching a pledge for healthcare providers to sign, and we're going to, once we go national with it, as I mentioned in my presentation, we're going to start by piloting it here in the DC area, but once we go national with it, we're going to be asking all of you folks and people around the country who are in our networks to go to your pediatricians, your OBGYNs, and other healthcare providers and ask them to sign on. So that's going to be really one of our priorities in the coming months.
And many state coalitions have the they have the opportunity and the option to write a letter to all of the pediatric offices and OB offices in their state, asking them not to do that, not to give this out, and to stop giving out these gifts. In many OB offices, the mother will receive one of these formula gifts each trimester. Some of the a couple of formula companies have a gift that is designed for each trimester. And so we would ask again that the OBs stop doing that. Many of them don't realize that this is an actual problem. And so this is why it's important for you to contact them, not just with a letter, but sometimes in person.
Mm-hmm. And I was just going to add that there are a couple of mentions and comments about the AAP resolution, and if folks are not aware, there was a resolution proposed to the AAP Leadership Forum earlier this year, specifically about divesting from formula marketing in pediatric offices. And while it did, it was passed, it was accepted, it was not voted into the top 10, and the meaning of that, if it gets voted into the top 10, it becomes a priority for AAP National and becomes advisory to the board of AAP. So again, while it did pass, it was not given that priority status. We have talked a little bit within USBC and with our representatives there about this and what's really holding this back, and as this commenter also mentioned, the private practice pediatricians are really not supporting this resolution. They're not ready yet. They may not be informed. They may not be educated about the issue. So as Liz and Marcia were saying, it is very important that we can, as breastfeeding advocates, reach out to them individually as well as through whatever other channels we can to educate them. And so what their suggestions are very good about reaching out to local pediatricians in your state. I think we're running short on time here. What we will, again, share all of these questions with the speakers, and when we export them, we can pull out your email address so that if we did not get to your question, we can respond one-on-one. And then again, the link that Liz provided in her slide, I'm going to go back to it now because this link is where the materials will be, both from this webinar as well as the instructions. Whoops, I went to the wrong spot. So this link here on the slide, full instructions for making follow-up calls are there. We'll also post materials. There will be materials on the Band of Ag's website as well. And like I said, that link will be in your follow-up email. So if, in case you're not in a position to write it down now, you will get a follow-up email from the webinar system with all of the links that you'll need. So. And unless there's any other comments that you guys have, it looks like we're running out of time. But thank you so much, Liz and Marcia, for joining us and for providing all of this practical tips and tools for following up on the campaign.
Thanks, Megan.
Thanks so much, everyone. Take care.
Thank you, everyone. Bye-bye.